Well, good afternoon. It's great to be here. And I get to sort of frame the importance of nutrition. That's very easy to do. This issue affects everything about child development, and it even affects everything about education and economic development. We all know that health and well-being are deeply connected. Healthier women have healthier children do better in school, and they grow up to be productive members of their community. And our end goal, that every country be self-sufficient and offer great opportunities to its citizen, it really is dependent on these productive communities that create economic stability for entire countries. So the virtuous cycle has a few key things that are absolutely necessary. And I would say that nutrition belongs at the top of the list. In fact, I was at a conference earlier this year where somebody said if I could have one magic thing where we could solve a problem, what would be the top of the list? And it was pretty easy for me to say that solving nutrition would be the one thing that would have such a big impact. Now, there are many other things, but it really rises to the top because of the scale of the issue. In poor countries, anywhere from 30 to 50% of kids never develop physically and mentally. And that really is holding those countries back. In the mortality area, the kids who are malnourished have a dramatically higher chance of dying. In fact, undernutrition is the underlying cause of 45% of those deaths. That is, if we could get rid of nutrition, then you would see measles deaths, malaria deaths, diarrheal deaths, all of those would go down very substantially. So this is a critical topic that we're talking about. It's not a topic that we understand everything about. And so one of the things we do with our nutrition budget is we fund research. In fact, tomorrow I'll be at the National Institute of Health, and one of the key topics we're talking to them about is child development. You know, why are there early deliveries? Why is there low birth rate? What are the nutrients that kids need at various stages? So a lot still to be solved there, but as you'll hear today, there's a lot that we know. The basic issues about nutrition, we can execute at reasonable cost, and the numbers will come later, interventions that could dramatically improve things. We know that nutrition has to start before conception. We have to have mothers eating the right foods. We know those first 1,000 days are very important, from the start of the mother's pregnancy through until the child's second birthday. That's a critical period for both physical and mental development. And if you miss that, there's nothing you can do later to solve it. One tactic that's very clear is exclusive breastfeeding in the first 6 months of a child's life. That single intervention keeps them away from infection and therefore helps them to develop not only the antibodies they get, but the nutrition they're getting is exactly right for their brain development. We understand the importance of essential vitamins and minerals for both children and women. And today, with the release by the World Bank and Results for Development, we're being very specific about the interventions that can save these lives and improve the outcomes. One tactic that I think is pretty amazing because it is so cost effective is food fortification. It doesn't solve everything, but it's of growing importance, and it can be done virtually everywhere. And so food fortification comes into that maternal diet. An example is in South Africa, fortifying the wheat and the corn with folate contributed to a 30% decline in birth defects of the brain, spine, and spinal cord. And so folate fortification, iodine fortification, those are very proven interventions. There's a lot more micronutrients that we can be adding. as many as 500,000 preschool children go blind because of vitamin A deficiency. And a lot of those children don't survive. For example, if you look specifically at measles deaths, vitamin A shortage is highly correlated with being susceptible to measles, not only making you sick, but killing you. In West Africa, the regional cooking oil producers are now committed to put vitamin A into the fortified oil. And in this region alone, that would be 80 million people across 8 countries. And the success with those countries has encouraged others. So we have a total of 14 countries that now have legislation that are mandating this vitamin A fortification. The extra cost to do the vitamin A fortification is very, very small compared to the benefits. You know, the currency that all of us sometimes work in is dollars per disability adjusted life year. Very, very high up on the impact per dollar of all things in health are the nutrition-related interventions, particular things around food fortification. So we have 2 billion people globally who are suffering from these deficiencies that food fortification could take care of. Breastfeeding, of course, is another very key thing. The Lancet study showed that if we achieved full compliance with exclusive breastfeeding for the first 6 months, that would save over 800,000 lives every year. Where do we stand today? Well, less than 40% of children in these countries where it's so critical are exclusively breastfed for the first 6 months. Initiating breastfeeding very early on is critical. That's actually the very first vaccination is the incredibly rich mother's milk antibodies that make a huge difference in protection for pneumonia and diarrhea from the very beginning. And there's no doubt that breastfeeding is associated with lots of positive outcomes, including mental capability. Now, we don't have perfect tests for brain development, but we have enough to see that this is really kind of a dramatic intervention. Over time, through some physical markers, we hope to have things that let us go in and really assess mental development. But the big things like breastfeeding already, even with our imperfect measures, show us huge benefits. Let's take Nigeria. There, only 17% of children are exclusively breastfed in the first 6 months. And changing that alone would save 100,000 lives a year. And the cost to get the word out, to get that behavior change, is only $3.50 for every newborn. And so that would, if we make the investments we're talking about here today, we would drive the exclusive breastfeeding from 17% to over 50%. And that's pretty amazing. Research and development is something that we're very committed to. Looking at things like why don't oral vaccines work in a lot of these populations. We first got exposed to that to work on the polio vaccine or the rotavirus vaccine, and seeing that the take rates in various countries are much lower than some others. And now it's understood that there's something going on in the gut, an enteropathy, that's causing a very bad condition that not only affects that vaccine, but is affecting the entire growth and nutrition of that child. So we need cost-effective interventions. We need to really study best practices of delivery, sometimes going through the school program, sometimes going through the primary healthcare system, having measures to make sure countries know how well these delivery things are working. A lot to be done and a huge opportunity in this digital era. We can get a lot of collaboration with other programs. For example, in agriculture, if we're getting more milk available at a far lower cost, simply by getting women often to have chicken, so they're diversifying the diet. There's a lot we can be doing in water and sanitation so that the exposure to these pathogens is much less. So integration will be important, including biofortified foods, growing the crops that naturally have these things. Measurement will be important to understand where we're having impact. And so constant feedback about how countries are doing or the investments really being used in the best way possible will be important. So there's a lot of progress that's possible. It's not inevitable. We do see countries that are outliers in doing this stuff very well, and we have a chance to learn from them. We have a lot of countries that we want to have get out in front. Nigeria, Ethiopia, Brazil's done very well, Peru, Vietnam. The leaders there are talking about their commitment to these programs, and they're going to take the resources and the plans we're talking about here and put those to best use. So this is the beginning of good health for these countries and really giving their children a chance to thrive. And that's why we're excited to be part of it. Thank you.